Hi everybody, and welcome to a video that is the start of parenteral medications. So in this video I'm going to go over the use of ampules, the use of vials, some reconstitution of a powder into a liquid, and then finally some injections. So let's get started first becoming a little bit familiar with some of the equipment that we have. So certainly we have syringes and needles. So syringes come in different sizes, right? This is a 3 milliliter syringe. This is a 10 milliliter syringe. You'll notice that there are calibrations or markings on the barrel of the syringe. And again, these open by peeling them down. So the markings that are on the barrel are, essentially breaks that syringe into smaller increments. So this 3 ml syringe is basically in half millimeter increments and also in tenths of a milliliter as well. So if I needed to, let's say, give a medication that was 2.6 milliliters, right, I would draw back my plunger to the one line below 2.5. Now what's important to note here, I'm just going to flip this around for a second. I want you to have a close look and I want you to notice those two black lines that are there. When you're drawing up medication into a syringe, you're always going to be looking at the top black line, okay? So this top black line right here is where you are looking in terms of, how much medicine you actually have in that syringe. So this is called the barrel of the syringe. This is called the plunger of the syringe. We want to keep our fingers off the plunger and just use this sort of round circle at the end to move the plunger in and out. We also want to keep our fingers off of the connecting port up at the top, right? So no contamination of this. And then, of course, we have various size needles, which we'll talk about sizes when we get to the injections, but needles come in separate packages, right? And this particular needle is a 21 gauge needle by 1.5 inches. So this is a larger size needle. So when we talk about those gauge numbers, remember that the higher the number, the smaller the gauge or the diameter of the needle. So if we would open up this package, when we take this out, we want to be sure not to touch the hub, right? Again, this is the sterile portion of the needle. So if we're going to put these two pieces together, we're not touching this and we're not touching this. And they go on with just a simple twist, okay? This particular needle that I have here has a safety device on it. So if I were to take the cap off, and after I've used this needle, I would simply flip this up until it clicks into place, and now it is a safety needle, and I cannot use this needle anymore. Let me just open another one because I want to try to show you the needle in and of itself by taking it out of its covering. Okay, so if I just take this needle out, now I couldn't use this needle, right, because I've put my fingers on the hub, but I'm just trying to show you, I'm hoping that you can see that the tip of that needle comes to a sharp point. And this is referred to as the bevel of the needle, right? So the bevel of the needle, when you're talking about giving an injection less than 90 degrees, you always want the bevel facing you so that the pointiest part of the needle goes into the patient's skin first, right? To make it less of a painful injection, okay? So needles and syringes come in different sizes, and you're going to base your selection on, how much liquid do you have? In other words, what size syringe do you need? And then what are you doing with that needle, right? Are you putting it into the patient's skin? And if you are, is it going subcutaneous? Is it going intradermal? Or is it going intramuscular? So those are important things to consider. The other thing to consider when you're going to be injecting patients is whether or not, what we call the patient's body habitus, right? How big is the patient? And so if they have a lot of subcutaneous tissue, then you generally can use a longer needle, right? If they don't have a lot of subcutaneous tissue, you want to use a very short needle. But again, we'll talk about that in a little bit further. So let's just go through some of the I want to start off with ampules and taking medication out of an ampule and then taking medication out of a vial as well. So first and foremost, I'm going to do hand hygiene. I'm going to put some gloves on because I really don't want to get any of that medication on my skin, right? So let's look at an ampule. So an ampule is a glass container. Literally, it is a glass container. Oftentimes they come in a brown color because the medication that's in there has to be protected from light. Of course, it has all the information about the medication written on it. And then I want you to notice here that there's kind of an indentation. We call this the neck of the ampule. And essentially, you're going to be breaking the neck in order to get the medication out of here. Now, one thing you have to make sure of is that all of your medicine from the top portion of the ampule is down into the bottom portion, okay? So you can give the top a little bit of a flick. So I'm going to show you how to open the ampule in two different ways. One would be using something that we call an ampule breaker, and that's what this little thing looks like. So you fit the ampule breaker onto the top of the ampule. And when you're breaking an ampule, you always want to break it away from you, never towards your face, right? Because this is glass, okay? So I'm going to just push this down a little bit, and I'm going to use my thumb to kind of push forward, right, and break the neck of that ampule. So here's my top portion of the ampule, which would have to go in the sharps container. And now I have my ampule, right, with the neck broken off, and I have to get the medication out of here. Now, when we're taking medication out of an ampule, you need to keep in mind that some very small pieces of glass that wouldn't be, visible to the naked eye might be inside that liquid. So we need to use a special needle, which is called a filter needle. And filter needles cannot be used for injection. And that should make sense to you, right? If I'm using a filter needle to get potentially little pieces of glass out of the ampule, I don't want to use this to inject into my patient. This is quite a large needle, okay, and essentially it has a cap on the end. So let me grab I think I'll use my 3 milliliter syringe because what I have here in the ampule is 2 milliliters. I'm going to take the cap off of here, and I'm going to attach my 2 hubs together, and then I'm simply going to pull off the cap. Don't twist the cap off because that loosens your needle. So you just want to lift the cap off. Then I'm going to take my ampule, and I'm going to put my needle into the ampule, and I'm going to start drawing back on my plunger, right? And as I'm drawing back on my plunger, let me see if I can turn my hand a little bit. You see I'm only touching the circular portion, right? As I get down towards the bottom, okay, I need to pull back, and I can use that bevel to kind of face it downward so that I get all the liquid out of my ampule. So I have all the liquid out of the ampule, and now I have my my 2 milliliters of fluid in here. So I'll just show you that top black line is up to the 2 milliliter mark. And then I could replace my cap. So let's talk about cap replacement. We never, ever, ever want to recap a needle, particularly after we have given an injection, right? So we have a safe way to recap, and it's best to recap in this manner all of the time, whether you've just injected or you've just drawn up a medication. So the cap goes down on the table, and one-handed, you pick up the cap with the needle, bring it upright, and then push the cap down. Okay, so this is now ready to give. Okay, this whatever we're going to do with this medication. If we're going to inject it into a patient, or if we're going to inject it into a bag of IV fluid, we need to change this needle. Remember, this filter needle, you cannot use it on a patient or use it again, basically, after you have taken out the fluid from the ampule. So we would replace the needle. Right? Now I put one of these safety needles on because I'm trying to conserve my supplies here. But now we would be ready to go to inject this into a bag, or perhaps go to the patient's bedside and give an injection. All right, so that's one way that you can open up an ampule. Now, let me just tell you that I can tell you most definitely that I have never seen one of these ampule breakers in clinical practice, right? So how then are we going to open an ampule? So we're going to do it safely using a piece of gauze. I'm going to get that liquid to get down into the bottom of my ampule so that once again it is full on the bottom. I'm going to take a gauze pad. I'm going to wrap that around the top, and again, I'm using my thumb to push forward away from me. And then this ampule top, which is here in my gauze, this ampule top is going to go into the sharps container, and once again, I'm going to draw that medication up out of the ampule. So let me just, I have a waterproof surface here, so let me just show you once again drawing up out of the ampule. So the needle goes in, right, and we use, thumb, whatever you're comfortable with, to pull that plunger up to get that medication out of the ampule, and bevel down so that you can suck up everything. We have all of the medication in there. I safely put my cap back on one-handed, and then I'm going to make that needle change, right, to get rid of that filter needle to make sure that I don't inject any of those glass pieces into my patient, okay? All right, so that's our ampules. Now, we also have vials. We have different size vials. This is a vial of insulin, okay? And this is a vial of Benadryl, and you'll notice it's in a dark glass because it needs to be protected from light. This is a vial of folic acid, okay? So these vials are sometimes single-use or they are multi-use, meaning that you can get multiple doses out of the vial. Okay, so let's open up both of them, and then we can, I'll show you some other things related to, of course, taking the medication out. So let's start with the small vial, okay? So first of all, it gives me the name of the medicine. It gives me a concentration. It says that there is 50 milligrams per milliliter, and this is a 2 milliliter vial. So what does that mean? That means that there is a total of 100 milligrams in this vial, right? So if I have to give 50, I'm going to give 1 milliliter. If I have to give 25, I'm going to give a half a milliliter. So these vials come with a small cap on the top. If you use your thumb to just flip off the cap, okay, the caps are disposable. You can't put the cap back on. It doesn't stay. All right. So once the vial has been opened, you'll notice that at the top there is a rubber stopper, and there is a little circle in there. You might not be able to see it on the video, but you'll be able to see it with the naked eye, where you're going to insert your needle. Okay. So the first thing I want to do is I want to clean off the top of the vial. Even if I just took the cap off, I need to clean off the top of the vial. So I'm going to use the alcohol swab, and I'm going to do a 30-second sort of scrub the hub. Okay, 30-second scrub the hub. I'm going to let that air dry, and then I'm going to choose my syringe and needle to meet my needs. Whatever kind of injection I'm giving, however many milliliters I need, I'm going to need the correct size. So let's get our 3 milliliter syringe, because I'm going to take a milliliter out of that vial. So I'm going to open this up. And we also have another type of needle, which is referred to as a blunt needle. A blunt needle, and it says it on the package, blunt fill needle. A blunt needle is a needle that doesn't have a point at the end. So you would never want to use a blunt needle to inject a patient, right? Because it doesn't have a point on the end. It's going to be quite painful. So I'm going to open this up, and I'm going to put these two pieces together by twisting them together. And then again, I'm just going to pull off the cap. And I don't know how you can see, but you can see that there is no bevel to this needle. It is a blunt top needle, kind of just squared off at the top. All right, so my alcohol has dried. I need to draw out 1 milliliter of this medication from here. So my first step is I'm actually going to draw back 1 milliliter of air. And there we go, 1 milliliter of air. And I'm going to now I'm going to be holding this up in the air, but I want to tell you that you will have the vial on the table when you put your needle in, okay? I'm going to hold it up just so that it can be a little closer to the camera. So in that little rubber stopper with the little circle in it like a bullseye, I'm going to aim my needle right in there, and I'm going to give it a push in. And then I'm going to inject my air, and then I'm going to invert. I'm going to hold this vial and syringe with one hand. And if you could see very slowly, this plunger is coming out very slowly. And that's because of that air that I put in there. It's pushing now the plunger out so that it's filling with my medication, right? So there's my medication coming back into my syringe. Now I may need to give it a little bit of help. Right? And now one thing that you need to be cautious about is you see this little empty space where there's no label. We refer to it as a window. You want to make sure that the tip of your needle always stays below the level of the fluid. Otherwise, you're going to suck air into the syringe. So I'm going to go ahead and continue to pull back. I'm going to go a little past the 1 milliliter, and then I'm going to push this back up to my 1 milliliter marking. I'm going to invert it again back to its normal position and take out my needle, okay? So just to show you on the table, right, what this would look like. I would have my vial on the table. I'd pull back my 1 milliliter of air. I hold the vial steady between two hands, put the needle in, put my air in, invert, make sure that window is facing me, and then having the calibrations also facing me, I'm going to start pulling back on that plunger to get to my 1 milliliter mark. I'm going to turn it back, put the vial down, take the needle out, and I am going to safely recap this needle, right? One-handed, and then snap that back on in place. So I have my 1 milliliter of medication, okay? Now, these syringes that I showed you initially, the 3 ml, the 10 ml, these are referred to as standard syringes. We also have a syringe that is a specific for insulin, okay? So this tells you right here, this is an insulin safety syringe. It holds 1 milliliter or 100 units of insulin. This is a 29 gauge needle that is a ½ inch long. So this is a very small needle. So I'm going to open this up because our large vial here is actually a vial of insulin. So let's say that I needed to draw up 20 units of insulin, okay? So this is a different type of syringe now. You'll see this sort of cuff that's on the outside. That is a safety mechanism. So you have to be careful not to engage that safety when you are drawing up your medication or even while you're taking the cap off. So you want to hold this syringe by that piece, okay, and take the cap off again by just pulling upward. And you can see what a teeny tiny needle that is, right? Very short and diameter wise very small. Okay, I'm going to put my cap down on its side, all right, and I'm going to, because I'm going to be opening up this vial of insulin, I'm going to put the air in. So one thing to keep in mind is that when you put your, once you've put air into the vial once, you can't do it again. It doesn't work multiple times. It only works when the vial is brand new. So let's open up this insulin, again, using your thumb to kind of flip off that cap. And again, the cap is garbage, and we still have that rubber stopper. But I have to do a clean, so I have an alcohol pad. I'm going to do my 30-second scrub the hub. And then, of course, I'm going to allow that to air dry. Then I'm going to take my syringe. We've got the cap off. And I said, what did I say, 20 units of insulin? So I'm going to pull back that plunger until I get to the 20. Again, that top black line has to be on the 20. And again, I'm going to hold this vial down. I'm going to put that needle in. I'm going to do an invert. I'm going to have that window facing me, right? The window facing me. And I am going to inject the air. And then I'm going to invert. And then I'm going to start pulling back. And I'm going to stop when I get to my 20 mark, which is right about there. Okay? So 20 units of this is Humalog Lispro insulin, 20 units drawn up in the syringe. I'm going to go for my cap again, one-handed, okay? Might need a little help with the finger, it's a big cap. And I'm going to push this down, okay? We're going to save this one because we're going to use this syringe when we practice subcutaneous injections in a little bit of time. Okay, so that's drawing up medication out of a vial. So, as I said, some of the vials could be single dose and some of them can be multi-dose, and they will be labeled as such. So if they are a single dose vial, I don't know if you can see that, but you'll see it in the lab. Right on the top it says single dose vial. So even if I don't use the whole thing, I'm getting rid of this vial. I'm not saving it to give the rest of the medicine to some other patient. Our insulin vials, however, are multi-dose vials. This one is. So I would have to take my pen. Okay, let me just take my gloves off here. I would have to take my pen, and basically I need to write on the label the date that it was opened, right? I'm going to write the word open, and I'm going to say 10/14, and I'm going to say, I don't know, 3 p.m., and I'm going to put my initials. So these vials, when they are multi-dose vials, keep in mind that about the expiration date. So this vial has an expiration date of February 2029. But once this is opened, it's only good for 28 days. And that is the reason why we need to label it when it was opened, right? So that we know when it has to get discarded. So whenever something gets opened, we don't really pay attention anymore to the manufacturer's expiration date, okay? All right, so that's taking our medicine out of vials. The next thing that I want to show you is that of reconstitution. So you're going to get to practice this in lab as well, but reconstitution is about turning a powdered medicine into a liquid medicine. And when I say liquid, I mean parenteral medication, right? I'm not talking about a liquid that somebody could drink, okay? So Hand hygiene, gloves are on. I have 2 vials here. And again, you're going to get to practice this in the lab. I have a vial with liquid in it, and then I have a vial that's full of powder. So here's some really important things about this reconstitution business. So this vial of powder says that it is a 10 milliliter, it's Practi powder, like practice powder, 10 milliliter vial. And on the side, there's going to be a little chart. And on that chart, it's going to tell you for however much fluid you put in here, you're going to get a different concentration of drug. So if I put in 6 milliliters of fluid, I'm going to end up with a concentration of drug of 500 milligrams per milliliter. If I put in 7.5 milliliters of my diluent, I'm going to end up with 400 milligrams per milliliter. And then finally, if I put in 10 milliliters of my diluent, that's what this liquid is called, I'm going to get 300 milligrams per milliliter. So how do you decide which one on the chart you want to use? Well, I'm going to tell you how. It's going to depend upon your provider's order, right? How much drug do you have to give? So let's say we have to give 800 milligrams of this medication to the patient. It would make sense then that I would put in 7.5 milliliters of the diluent so that I create a concentration of 400 milligrams per milliliter. And then how many milliliters would I need to draw out of the vial in order to give that 800? So hopefully you're doing that math in your head, and you know if you have 400 milligrams per milliliter and you need 800 milligrams, you're going to need 2 milliliters, okay? So you're always going to have some sort of a chart that's going to give you different concentrations or strengths of the medication, and that's going to help you determine how much diluent you're going to put into this vial. So let's get started. I'm going to pop the caps off of both of these vials, okay? And then I'm going to clean both of them with some alcohol, okay? I'm going to do that 30-second scrub the hub. We'll say that that's 30 seconds. That's my first vial. My second vial, I'm going to do another 30 seconds to clean off that vial. And we said that we're going to make this into the concentration of 400 milligrams per milliliter. So I need to put 7.5 milliliters of diluent into this vial to get that concentration of 400 milligrams per milliliter. So I'm going to use a larger syringe now. I'm going to use the 10 milliliter syringe. Okay, so 10 milliliter. The big lines are 1 milliliter apiece, and then each little line in between is 0.2 milliliters, okay? So it told me I need to put in 7.5 milliliters of diluent. So let's get a nice size needle here, right? And I'm going to put the syringe together with this needle, okay? And my cap came off. Let me get this out of the package. Okay. So I have my needle onto my syringe. So first step, I have to put 7.5 milliliters, right? So let me bring this back and get it to where I need it to be with my air. I'm going to take off my cap and I'm going to put this air into the diluent vial. I'm going to inject it right in there, and you might find some resistance, especially when you're trying to put a lot of air in there. Hold that plunger, okay, with that resistance. Flip over, get your needle below the level of your fluid, and you're going to start to see your plunger is coming out by itself, and you are filling your syringe with that diluent. So let's get us to the amount that we need, right? Let's pull that back a little bit. Okay, So I have got my amount. I'm going to invert back, take my needle out, set the diluent to the side. I am now going to put this diluent into my powder vial, right? So right in the middle, bullseye, I'm going to push this liquid in, and then I'm going to remove the needle. But before I remove the needle, there's a lot of pressure. I'm holding this really tight with my right thumb. I'm going to let this plunger come back. Okay, I'm going to pull the needle out, not all the way out. I'm going to let the plunger come back so that the air can come out of the vial before I take my needle out. Then I'm going to safely recap this needle. Okay, one-handed. Snap it back in place. I'll put that to the side. And now my diluent is in here with my powder. We never do any kind of shaking. We just simply want to roll it back and forth. Okay, back and forth, because we have to make sure that all of that powder has been dissolved by that diluent. Okay. We can also do a little sort of flipping like this. Okay, and then I'm going to take a look through my window. I'm going to look at the bottom. I'm going to make sure that all of that powder has been dissolved, which it looks like it has, but I'm going to give it just a little extra here. Okay, and now if you remember, right, from our little chart, we know now that we have a concentration of 400 milligrams per milliliter, and my order was to give 800 milligrams. So I only need 2 mLs. So I can use this same syringe. I'm going to go up to my 2 mark. Okay. I'm going to take my cap off. I'm going to clean the top of this vial again with my alcohol for 30 seconds. Okay. I'm going to go into the bullseye, put my air in. I'm going to flip, get that window facing me, get the needle below the level of the fluid. I'm going to let that plunger come on back, and then I'm going to give it a little help. Okay? And I want to get to the 2 milliliter mark. And this actually is perfect because I have a big fat air bubble, and I want to show you what we're going to do about air bubbles. Okay? So let's invert this and take this needle out. So I want you to have a look here, and I'm hoping that you can see that bubble that just moved, right? You can see a little bubble down here, and then you can see a bubble up at the top. Every place that you have air is a place that is taking up the space where medicine should be. So this would be underdosing the patient. So here's what I want you to do first, okay? I want you to tap this syringe on the end of the table. And you want to try to move that air bubble that's at the bottom and move it up to the top. Okay? If that doesn't work, you can do this whole flick method, and now you're going to see that along the bottom, that air bubble is gone. So I'm talking about down here, right? That air bubble we had before is gone, but my air bubble up at the top has gotten bigger. So here's what I'm going to do. I'm actually going to pull the plunger back a little bit. I'm going to put more air in there, and then I'm going to hold this perfectly level, and I'm going to start moving up my plunger very, very slowly until I have expelled all of the air. And then I'm going to do a double check, right? Because you saw a couple of drops came out at the top. I'm going to do a double check and make sure that I have my 2 milliliters of medication or my 800 milligrams. Okay, and I do. So this is good to go. I am going to safely recap this. Now, we have one of 2 options with this. Perhaps this medication is now going to get injected into a patient. If that were the case, I would have to change this needle, right? You have to change the needle because we've already put this needle in and out of vials multiple times, and believe it or not, that damages the integrity of the needle. So if I'm going to inject this into a patient, I'm going to take this whole needle off, right? And I'm going to change it to the needle that I need. But if I'm going to simply inject this medication into an IV bag, I don't need to change the needle, okay? So let's do that. Let's inject it into an IV bag. So IV bags come in different sizes. This is a small 100 milliliter bag, and this is normal saline, 0.9%. Whenever you're going to use an IV bag, you want to hold it up to the light. You want to have a look, make sure that there's nothing floating in it. You want to check the expiration date. This is expiring in January 2024. You want to make sure that your bag is intact, that there are no leaks, okay? And then we're going to take a look at the bottom of the bag. In the bottom of the bag, we have basically two ports. This port here with the beige sort of top, this port also has a bullseye. This is the port where you would add medication, okay? The other side is where you will attach your IV tubing, okay? So two ports, one to put the medicine in, one to attach to the IV tubing. Okay, so let's get this medicine inside this port. So I need another alcohol swab. I need to clean off this port, right? So I'm going to scrub this hub for 30 seconds, okay? Then I'm going to make sure not to put the bag down or to touch that port in any way. I've scrubbed the hub for 30 seconds. I'm going to take my syringe. I'm going to pull off my cap. Remember, no twisting, just pull. And I'm going to aim this needle right into the center of the bullseye, push it in, and then inject my medication into that vial, into that bag. I'm going to take this out, and I am going to engage that safety. Click it into place. Now I can put that in my sharps container. Please remember that all syringes, whether there's a needle attached or not, goes into the sharps container. So now I've put that medication into this bag. I can kind of just flip it around a little bit, make sure it's evenly distributed. And now I have to label the bag, right? I have to make sure that people know what is in this bag. So all kinds of labels you're going to see in the clinical area. This is the labels that we have, and it says medication added. So first of all, it says patient name, so we'll use the same patient as prior, Mr. Smith. Room number is 10B, and the drug is cephaloxin, which is an antibiotic, and the amount was 800 milligrams, right? And then added by my initials. The base solution was the normal saline, so I'll put 0.9% NS. The date is 10/14. The time is 3 p.m. And then it asks for the start time. So if I were going to hang this up right now, I would put 3 p.m. and on today's date, the 14th, and the flow rate, let's say it had to run over 30 minutes, and it's a 100 milliliter bag, so that would make it 200 milliliters an hour. And the expiration date. So here's a great question. After you've reconstituted a medication, how long do you think it's good for? You think it's good for as long as the vial said that it's good for, or the expiration date on the vial? No. Once you reconstitute a medication or you put a medication into an IV bag, it's only good for 24 hours. So our expiration date here is 10/15 at 3 p.m. Right? I'm going to take this label and I'm going to put this on the back of the bag, because I do not want to cover the barcode on the front of the bag, because, you know, we use barcode scanning in the hospital. You're going to need to scan that barcode, okay? So that is our drawing up out of ampules, vials, and then the reconstitution process. And again, you are going to practice this in lab, okay? All right, so next up, let's talk about injections. So we're going to start off with the intradermal injection. So intradermal injections are just that. They go into the dermal layer of the skin, or the dermis. The angle of injection is about 15 degrees. We want to use small needles, meaning both gauge and length. We, of course, will have to have the bevel of the needle facing us because we're giving it at an angle less than 90 degrees. And a very common intradermal injection is that of the PPD, and many of you have had PPD, right? Or allergy testing is another good example. So we're talking about small gauge needles, so that means the higher the number, the better. So maybe somewhere between 26 gauge and 32 gauge would be good for intradermal, which is really the same as it is for subcutaneous, okay? So we're going to pretend we're going to give a PPD, all right? So believe it or not, there is a specialized tuberculin syringe, and this is what it is. And you see right here, it says 1 milliliter TB syringe. What is unique about this syringe is that it is calibrated in 1/100ths. It is the only syringe that comes calibrated in 1/100ths, and you can see all those tiny little lines, and each of the larger lines are equal to 1/10, okay? But the whole syringe holds 1 full milliliter. So usually the PPD is a very small amount, usually 0.1. Okay, so we can pull our plunger back to that 0.1 to get that air in there. And then we have a vial of PPD solution. We'll take the cap off, and then of course we have to clean it again with our alcohol for 30 seconds. Okay, get that nice and clean. We're going to take our tuberculin syringe, take the cap off, and remember it's just a pull off, don't twist it off. And I'm going to go, I have my air drawn back already from my 0.1. I'm going to go right into the center. I'm going to inject my air. I'm going to flip it up so the window is facing me, have the calibrations facing me, and I'm going to pull back that 0.1 milliliter. Go a little further than I needed, and so I push everything back up until I get to that 0.1. Take my vial off. I'm going to safely recap, snap it down, okay? And then I get ready to go to my patient. So I go to my patient, I do hand hygiene. Of course, this is a medication, so I'm checking that medication 3 times before I give it. I'm following all of those 5 rights of medication administration. And then, of course, the 6th right will be the documentation. I want to make sure that I have this prepared and explain to my patient what I'm doing, and since this is a PPD, we have to talk to the patient about what that means, right, in terms of testing for tuberculosis and what kind of result we are looking for, which of course would be a negative result. Okay, so intradermal. So I have this little arm here. I'm going to put it here on the corner so that you can see a little bit better. Have an alcohol swab. Now, some references say that you do not even need to use alcohol for an intradermal, but we're going to use some alcohol. I'm going to clean this area starting in the middle, making some concentric circles around. I'm going to make sure that this alcohol dries completely. I'm not going to blow on it. I'm not going to fan it. I'm going to take my needle and syringe, take my cap off, and I'm going to make sure that that bevel is facing me. So the bevel is facing me, and I'm going to go in. I'm not going to pinch the skin, nor am I going to spread the skin. I'm just going to put my hands here, and I'm going to go in at about a 15-degree angle, and I'm going to inject this PPD, and then I'm going to pull my needle out, and this is going to go directly to my sharps container. Now, when you give an intradermal injection, okay, you are essentially attempting to create something called a wheal. It's similar looking to a blister, right? And that's what you want to create on the skin here, okay? You can put a Band-Aid on top of it if you like. It's not necessary. You're not going to wipe it off with any alcohol. You're essentially finished, okay? So I'm just going to bring this a little closer to the screen, just so that, or the camera, just so that you can see a little bit better, okay? Bevel of the needle is facing me. I'm going to go in at a 15-degree angle, okay? Right underneath the skin. I'm going to push that plunger. That medication is going to go in, and it is going to create a wheal, or very similar looking to a blister. I'm going to remove this needle. There is no safety device on this needle and syringe, so this is going to go straight to the sharps container. I am not attempting to recap this. I'm not even attempting to recap it safely. No recapping at all after you have injected. Okay, so that's our intradermal injection, okay? Intradermal injection. So now let's move on to subcutaneous injection. One more thing on the intradermal. So where can you give intradermal? You can use the forearm, you can use the upper scapula, even the upper outer buttocks, okay? Now comes the subcutaneous injection. So subcutaneous injections are also given with small, short needles, so 26 to 32 gauge, maybe 5/8 or 3/8 of an inch to a half an inch. On occasion, we use a full inch needle, but that would be for a patient who has a large amount of subcutaneous tissue. Okay, so we're going to practice with that insulin that we drew up before. Okay, so with the insulin we drew up before, we're thinking about where can we inject insulin. Well, insulin can get injected again in subcutaneous tissue. So where is that tissue? Well, we have subcutaneous tissue on the backs of the arms, right? We have subcutaneous tissue in the abdomen, 2 inches away from the umbilicus in any direction. We have subcutaneous tissue on the scapula in the back, the upper outer buttocks, and the thighs as well. One thing about insulin, for people who are getting injections frequently, we want to rotate those areas. So whenever you give an injection, whether it's intradermal, sub-Q, or IM, you want to make sure that you are documenting where did you give it, so that the next nurse doesn't give it in the same place, okay? So let's get ready for our subcutaneous injection. I'm going to cleanse my skin. I'm giving this on the back of the arm. I'm going to cleanse my skin, put the alcohol down, start making small circles, bigger, 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 nice concentric circles. I'm going to let that air dry. I have my insulin prepared from before, that 20 units of insulin, okay? So I am going to explain to the patient what I'm doing while I'm waiting for that alcohol to dry. I'm going to tell you that for subcutaneous injections, remember I said for intradermal we're not doing anything to the skin, but for subcutaneous we are going to pinch the skin. We want to pinch the skin as if you're trying to gather up the fat. Okay, so we're going to pinch the skin. We're going to hold that pinch while we inject, and then we're going to release the pinch before we take the needle out. And hopefully that makes sense to you, right? If you're pinching the skin and you give an injection and you take the needle out and you're still pinching the skin, you're going to be squeezing that medicine out of the skin. Your patient's not going to get their full dose. All right, so this is nice and dry. And remember I told you with this needle, because of the sleeve here, you've got to hold on to the sleeve while you pull your cap off, okay? And again, very short, tiny needle for this insulin injection. Now, subcutaneous injections can be given at a 45 to 90 degree angle, depending upon your patient's body habitus. However, there is an asterisk there, and this is the exception to that rule. Insulin is always given at a 90 degree angle, always given at a 90 degree angle. Okay, so we're going to pinch up this skin. I'm going to take this syringe, and it's all in the wrist, okay? All in the wrist. You are going to go in at that 90-degree angle. You're going to hold that syringe steady. You're going to move a finger up to the plunger, push the plunger, release the skin, take out the needle. And in this instance, we can engage that safety, right, to cover up that needle. I'm not going to click it into place because I want to use this over again, but at the end I'll show you. But you're going to pull this up and click it, and then it's going to go in your sharps container, okay? So that is our insulin at 90 degrees. So let's say that we have a different medication to give. So actually I can show you this because I have another syringe to use. So this pulls up and it clicks into place, okay? So it has covered your needle, all right, to keep you safe. And then this goes in your sharps container. All right, so I actually have another subcutaneous needle and syringe here. This is a 3 milliliter syringe with a 25 gauge needle that is 0.625 inches in length. So again, pretty small needle. So I'm going to take this out, and you'll kind of recognize this side piece. I want to kind of get it out of my way. And let's say, I don't know, what can we give subcutaneously? Hey, let's give some heparin subcutaneously. Okay, so I'm going to take a vial, okay, of heparin, and I'm going to clean off the top of the vial, 30-second scrub, okay, and I need to give 5,000 units of heparin, which is in 1 milliliter of solution. So I'm going to pull back my plunger to the 1 milliliter mark. Okay, I'm going to take my cap off. And you see, this is a small needle, not quite as small as the insulin one, but very thin and still pretty short. Okay, I'm going to go into the bullseye here on my vial. I'm going to push in my air. I'm going to do that flip, get that window facing me, and I'm going to help that plunger pull back a bit to get to the 1 milliliter mark. So I already see that I have some air. I think you can see that there up at the top. So before I even take the needle out, I'm going to push this forward and see if I can push that air back up into the vial. Looks like I did. So I might be good here. Okay, I'm going to get to my 1 milliliter mark, kind of look around. I don't have any air bubbles. I'm going to invert again. I'm going to take this needle out. I am going to safely recap, one-handed, snap this on, and now I'm going to go to my patient's bedside. So I'm going to explain to the patient. I'm going to choose my sub-Q area, and we're going to give it on the back of the arm here, okay? And I want to show you this at a 45-degree angle, right? So I'm going to clean the skin again from the middle out, let that alcohol dry, and remember, if I'm giving any injection at a angle less than 90 degrees, I've got to do bevel up, okay? Bevel up. So bevel is up. It's facing me, okay? And I am going to just let that alcohol dry for a moment, all right? And bevel up. Okay, alcohol is dry. I'm going to do a pinch here, and I'm going to go in at that 45-degree angle. I'm going to inject, release the skin, pull out the needle. Okay, so let me just show you that a little bit more up close in the camera. So we have this. I'm going to pinch up that skin. Okay, and I'm going to, let me make sure where my bevel is. There's my bevel. I'm going to go in at 45, let me go this way. I'm going to go in at 45-degree angle. I'm going to push the plunger, release the skin, pull out the needle. Okay, you got that? So one more time. We've pinched up the skin, bevel up, 45 degrees, push the plunger, release the skin, pull out the needle. And now, safety, okay? All right, now, IM injections. IM injections, of course, are given intramuscularly. In terms of absorption rates for these different kinds of injections, you should, realize that intradermal has the slowest rate of absorption, and sub-Q is kind of like intermediary. And then IM has the fastest rate of absorption. Why is that? Because muscle is highly vascular. So muscle, of course, lies below the level of the subcutaneous tissue, so we have to make sure that we have a needle long enough to get there. So these needles tend to be bigger in diameter, and they tend to be longer, upwards of 1 inch to perhaps 2 inches in length. And again, you're going to look at your patient's body habitus in terms of what size needle you want to use and what are you giving. If you're giving a very thick solution intramuscularly, you're going to need a bigger diameter needle. And if your patient is larger, you're going to need a needle that is, of course, longer as well. So here we're talking about gauges that are anywhere from about 21 to 23, roughly. Okay, 21 to 23. And I've posted something for you with all the gauges on it. All right, so let's take a look at this syringe. So this, again, is a 3 milliliter syringe. It has a 22 gauge needle that is 1.5 inches long. Okay, so let's open this up and have a look at this. So this 3 milliliter syringe, again, is calibrated in 0.5 milliliters. And if we take the cap off this needle, you can see that this needle is quite larger, right? It is longer and the diameter is bigger. So let me just safely recap this, okay, while we think about where we're going to give an IM injection. So first and foremost, IM injections are given at 90 degrees, no exception. Always 90 degrees because we've got to make sure we get into the muscle. Another rule about IM injections is that we aspirate on all IM injections with the exception of immunizations. Lastly, in terms of rules about IM injections, we only have certain areas where we can actually give the injection, okay? So we have basically 5 places. We have the deltoid muscle, right, in the upper outer arm. We have 2 areas in the thigh. We have the side of the thigh, which is the vastus lateralis, and we have the top of the thigh, which is the rectus femoris. And then we have 2 areas in the buttocks. We have the ventrogluteal area, which is sort of the upper outer hip. And then we have the dorsogluteal, which is the upper outer quadrant of the buttocks. So here's what I'm going to tell you. I know that everybody wants to give all IM injections in the arm, right? Because nobody wants to drop their pants to get an injection. But let me tell you this. Each of these muscles can only hold a certain amount of liquid. So if you have to give, for instance, 2.5 milliliters of a drug, you're going to be limited in your choices. And one of your choices is not going to be the deltoid. The deltoid can only hold a milliliter of fluid, okay? The other thing that's really important about these different IM sites is that they all have an anatomic location. So you have to really make sure that you are in the right place giving these injections. So you have to use those anatomical landmarks. And your textbook has a nice chart that goes through them, and you need to basically memorize them, right? Because you're going to need to demonstrate them in the lab when you give injections. All right, so let's give our patient, let's give our patient some folic acid, okay? So this says 5 milligrams per milliliter, and this is a 2 milliliter vial. So again, I'm going to clean off the top of the vial. I have chosen my syringe and needle appropriately for IM. I'm going to clean off the top of the vial. And we said there were 5 milligrams per milliliter. So let's say we have to give 10 milligrams. So that means I'm going to need 2 milliliters of solution. So I draw back the 2 milliliters of air, take my cap off. I'm going to go right down the center of that bullseye with my needle. I'm going to inject the air. I'm going to invert, make sure that the window is facing me and The needle is below the level of the fluid. I'm going to let that plunger sort of come back on its own, and it might not get to 2, but it's going to get about 1.5, right? So now I'm going to have to help it. I'm going to pull that down, and I'm going to look for some air. So I do have an air bubble down at the bottom. I also have one at the top. So let me take this needle out and let me safely recap this, okay? And let me do a little bang here. See if I can move that air up to the top. If not, I'm going to do the flick, and I'm going to get that air to move to the top, which it has. That bubble down at the bottom has disappeared, but now I have air up at the top. So again, I'm going to draw back until I have level fluid. I'm filling it with more air. And then I'm holding this very steady and level, and I'm pushing up that air until I'm at my 2 milliliter mark, okay? All right, so we have our 2 milliliters or 10 milligrams of folic acid, okay? And you'll notice that I'm squirting out the liquid. That's because I can't put liquid inside of these, okay? So that's why. All right, so I'm choosing my site. It's 2 milliliters. I can't use the deltoid. Now, I will tell you that the safest place to give an IM injection is in the ventrogluteal area, which is that upper outer hip. The least effective and most painful and least safe place to give an IM injection is the dorsogluteal. And that's because there's the potential that you could hit the sciatic nerve, okay? So I'm going to find my landmarks for my ventrogluteal area. And once I have determined that this is my spot, I'm going to cleanse my area with the alcohol, okay? Starting in the center, round, 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 out, right? Okay. I'm going to let that air dry. I'm not getting rid of my alcohol. I'm actually going to keep my alcohol between my pinky and my ring finger on my non-dominant hand, okay? I'm going to remove my cap straight up, no twisting to get the caps off. Now, instead of pinching the skin, I'm going to spread the skin. So I'm going to spread, think of it as moving the subcutaneous tissue out of the way. Always 90 degrees. Again, the wrist, all right? 1, 2, 3. In we go. First step, because this is not an immunization, I have to aspirate. I'm going to pull back maybe 1 or 2 small lines on my plunger. I'm going to look to see if I get any blood in my syringe. If there is no blood, I can go ahead and inject. Again, I release the skin. I take out my needle. I use that alcohol swab to cover the area and do a little massage, okay, because it's painful, all right? I may have to put a Band-Aid on it if necessary, all right? So that is our IM injection. Now, there is a, let me come closer to the screen to show you this one first, and then I'm going to show you something called the Z-track method. Okay, so I've cleaned the skin. I'm spreading the skin, okay? I don't know if I can, yeah, okay. And I'm going in at 90 degrees. 1, 2, 3, in. I'm keeping that syringe steady. None of this, okay? Very painful. Keeping that syringe steady. I'm going to use my thumb to pull back just a little bit on the plunger. If I see blood, I have to remove it and I got to start all over again, okay? Everything gets thrown out. No blood. I can go ahead then and inject this, release the fingers, and out comes the needle, okay? So again, spread, inject, check little aspiration, no blood, inject, release, out. Sharps container, no recapping, okay? Very important. Okay, so that's our routine or regular IM injection. I want to talk to you about something called the Z-track method. So there are some medications that are given IM that are extremely irritating particularly to subcutaneous tissue. So I want you to kind of try to imagine something. I'm going to use this other small model here. I want you to imagine that I'm giving an IM injection, right? I'm spreading the skin. I go in with this needle, right? I inject my medicine. I release the skin. That's funny. I take the needle out, right? On the inside, I have created a track, right? Basically, I've created a straight track for the length of my needle. So medication could conceivably leak up that track into subcutaneous tissue. So for most medications, it's not a big deal. But there are some medications that are very irritating to subcutaneous tissue and therefore will cause your patient a lot of pain. So we want to try to disrupt that track and not have it be the straight track where the needle went in, right? So here's what we can do for Z-track. So of course, again, cleaning your skin, okay? Letting it dry. I take my cap off. Instead of spreading the skin like this, I'm actually going to take a couple of fingers and I'm going to pull the skin to the side. And then I'm going to put my needle in. I'm going to do my little aspiration. I'm going to inject the medication. I am going to release the skin and take out the needle. So what I've done basically is I've displaced the subcutaneous tissue to one side. And instead of me having a straight track, I now have a track that on the inside that goes like this to the side and up, kind of like a Z. And that prevents that medicine from moving from the IM area into the sub-Q area. How do you know which medications or meds that you have to give by Z-track? It will tell you in the drug insert or in your drug handbook, any one of those places, okay? All right, so I think that is pretty much a brief overview of intradermal, subcutaneous, and IM. You certainly will have some practice in lab. The last thing that I do want to talk about just for a moment is that of these pens, right? So there are a lot of these different kinds of pens out on the market. Right? They could be insulin pens, they could be EpiPens, right? There's a medication called Trulicity that is used for our diabetic patients, right? So you're going to find that, a lot of these pens have dials on them. And so like if we look at this, and this is an insulin pen. I'm sorry, this is Repatha. I don't have an insulin pen, but I'm going to tell you that there's going to be a dial. So if you had an insulin pen, you literally would dial it up to the number of units that you need, and then you would inject, right, by pushing the button, and that will inject the insulin into the patient. We'll go over these in more depth, certainly in the lab, and have some more sort of show and tell stuff for you that you should find helpful. Okay? All right, so that ends our video about reconstitution and injections. I appreciate you watching, and I shall see you soon. Thanks.